The benefits of quitting smoking. What happens when you stop smoking? Fewer smoking is a leading cause of preventable deaths worldwide, with each cigarette containing over 7,000 harmful chemicals. Despite this, there are still 1.3 billion active smokers in the world. But what happens when you quit smoking? Within the first 20 minutes of quitting, your heart rate and blood pressure return to normal, as the nicotine in cigarettes causes an increase in heart rate and narrowing of blood vessels. This effect also causes smokers' extremities to feel colder, but after quitting, your hands and feet return to their normal temperature. Around 2 hours after quitting, nicotine cravings begin, causing moodiness, drowsiness, tense feelings, and difficulty sleeping, as nicotine releases more dopamine than normal. After 8 hours, the carbon monoxide inhaled from smoking clears, allowing oxygen levels in the bloodstream to return to normal. Carbon monoxide and oxygen compete to bind to hemoglobin in your blood, which stretches the circulatory system. As it clears, there is more room for oxygen. However, for long-term smokers, carbon monoxide exposure causes red blood cells to increase in size, making the blood thicker and causing higher blood pressure and increased chances of developing blood clots. Surprisingly, 24 hours after quitting, coughing will actually increase, which is your body's way of clearing out all the toxins from the lungs. Additionally, at this point, the risk of developing various coronary artery diseases decreases. Within 48 hours, nicotine and its metabolites are completely eliminated from your body, and damaged nerve endings begin to regrow. The tar and other chemicals in cigarettes leave fewer taste buds that are flatter with less blood vessels, but they now begin to regain their sensitivity, making food taste better. However, chronic smokers may often have irreversibly damaged taste buds. At the 72-hour mark, nicotine withdrawal peaks with headaches, nausea, cramps, and emotional symptoms like anxiety and depression. These symptoms can be seen with most addictive substances, including caffeine. But after this period, the worst is officially over. After 1 month, the risk of developing type 2 diabetes, cancer, and cardiovascular diseases has already decreased. In 3 to 9 months, the damaged cilia in the lungs are almost fully repaired. Cilia are hair-like structures that help sweep away dust and debris, and as a result, symptoms such as coughing and shortness of breath are almost completely eliminated. Around 1 year after quitting, the risk of developing heart disease as a direct result of atherosclerosis, which is the buildup of fatty material or scar tissue from deteriorating arterial walls, decreases by almost 1/2. In 10 years, the chance of developing lung cancer decreases to half of someone who did not quit smoking. In 15 years, the risk of a heart attack decreases to the same as someone who has never smoked in their entire life. Of course, these benefits are not definitive, and the average amount a person smokes per day or year will play a role in how well their body recovers. Unfortunately, there will always be some irreversible damage to the lungs, and smokers may have an increased susceptibility to developing various lung diseases. While quitting may be difficult, the benefits greatly outweigh the initial withdrawal. The best way to prevent the negative effects of smoking is to not begin smoking at all. If you have any burning questions, ask us in the comments or on social media, and subscribe for more videos.